Hi, Dr. Kane.
Good morning, Amy. How are you?
Good.
Perfect.
It's so great to have you with us.
My pleasure.
So if you could just introduce yourself and talk a little bit about what you do.
Sure.
And of course, we know you as a parent at Cold Spring School.
Okay.
But a little bit what you do. And we're planning our re-entry into schools plan, and really looking forward to having our kids back on campus. And so we're here today to talk a little bit about that. But first, go ahead and introduce yourself.
Yeah, so this came about because we're both runners, and I saw you in the morning, and we talked a little bit about how excited we were to restart school in fall 2020, and there were some reservations there, and so I just wanted to offer my help. I am a plastic surgeon by training. However, I do have a large administrative role in Ventura as the physician in charge of the Kaiser Permanente medical office building that has specialty, specifically our urgent care, which is where my coronavirus knowledge has come from. So I had a very critical role in developing our surge planning back in February and March, and then now that we're beginning to see some changes in the community, like what our responses are and how does that align with some of the work that I do on the sales and marketing side. So I work a lot with employer groups and trying to educate them about how they can begin to open up, specifically, small businesses. And so I see a lot of parallels with the schools and the classrooms, and just wanted to offer at least some of the early learnings that we have around this.
Thank you for that.
Yeah.
And so we discussed as we were running about temperature checks. So one of the things that we are going to be doing, and what we're asking is parents do a health screening before they even bring their child to school, and that includes a temperature check, making sure that's not above 100.4.
Sure.
And then we're doing our own screenings here with the staggered time and staggered entrance into school before the students come in and wash their hands. What do you think of that?
Yeah, I think so. Two of those things I think are beautiful are the ownership on the family side. So just being aware of what's going on with your kid. So I have a child who has an immune system problem. It's a mild thing, but it's something I have to be aware of. And so just to be in tune with it. And so I think that home temperature checks are great. I think that we had talked about infrared scanning. I think that's great. I think in the early days for us, we had to do the oral temperatures and then the forehead temperatures, and it seems to give mixed messages, right? So we're 6 feet apart right now, but if you were to come to me, both wearing masks, and I want to do your temperature with a temporal probe or something like that, there is some fear, there's some anxiety about that exchange. So I think it's really important to just, number one, understand what's going on with your children, how they're feeling, do they have any new symptoms. They're probably not going to talk to you about their taste or lack of taste, but if you notice a fever, cough, or some mild diarrhea, something abnormal, you probably want to cue in somebody about that. The temperatures are awesome because when you do it at home, you'll start to get a basal rate, which means you'll start to get averages. So if your child kind of uptakes just a little bit, at least it'll raise some awareness, and you'll have a little red flag go up, something maybe not right here, and so you can contact the school or the school nurse or whatever. The staggered drop-off, personally it's going to be challenging, just getting to work and stuff like that, but I think it's a great thing. I think it's a great thing. You also had mentioned limiting the amount of people on campus. I think that's awesome, specifically parents. Parents can stay in the parking lot or on the sidewalks. They can certainly give their children a hug there. I think that you have a lot of the strategies in place that really meet the needs of our community and our children. And specifically going back to those principles of hygiene, distancing, and disinfecting.
Thank you for that. Talk a little bit about students wearing masks, and what that is a requirement that we're going to have our students wear masks and teachers wear masks, and what is the effect that a mask has?
Yeah, so I think the mask has been unfortunately politicized, and I'm not going to get into that. But masks in general have proven to decrease the transmission of viruses. It's just boom. period, right? And so you look at countries that did a really good job with the coronavirus, whether you believe their data or not. So you look at places like Singapore and South Korea, some areas of China, Japan. So those are places that culturally, when someone doesn't feel well, they wear a mask. When someone goes into a public area, such as a metro, where there's a lot of people, they wear a mask. So I think undoubtedly masks are very important. I think it'd be great to kind of take the taboo out of masks, and I don't know if there's an opportunity for kids to design their own masks over the summer, or to have some local company develop a cold spring masks. I have a mask here, and if I were to put it on, it would work for some period of time, but then it would eventually, my nose would come out. There are some that are actually really nice. They're kind of like, I don't want to call it ergonomic, but they're just designed more appropriate. And you see those around, and I think those would be awesome masks for kids. I think if we make it fun, they'll abide by it. You know, having the appropriate mask is great. The mask is going to prevent you from essentially spreading the virus in its droplet form. Here we are in the early summer 2020. We're having this wonderful conversation, and a lot of it can change. And so I don't want people to then look at this video and say, well, you know, you're misinforming us, or I'm providing you with the same information that I have. I get daily briefings, both in Ventura County, Santa Barbara County, LA County, and our region. So I'm not an expert, but I just read all the stuff, and I try to keep things super simple. I'm a fan of KISS, right? Keep it simple, stupid. And I think if we just go to those principles of hygiene, disinfectant, and some form of distancing, it'd be great.
Thank you for sharing how things are constantly changing, because as a superintendent, that's our biggest challenge, is the information that we're getting. We feel like it changes from day to day, and how do we prepare for re-entry into school? And so part of what we know and what we're trying to do is keep that 6 feet-ish of social distancing in the classroom. So when feasible, so that may mean 5 feet at times, right, or an arm's length away. Also, disinfecting the classrooms in between cohorts is really essential.
Sure.
What do you think about those policies?
Those are the same policies that we have. So again, I work in the medical office building down in Ventura. That office building has an urgent care in it. That urgent care draws people who have respiratory symptoms. Some of those people who have respiratory symptoms have coronavirus. And so we have X's on the ground. We have staggered the rooms. We have created a respiratory side of the urgent care and a non-respiratory side of the urgent care. And so all of that means is that we just try our best. So are people going to not stand on that X? Yeah, they're probably not going to stand on that. Is someone going to reach around me to grab the handle of a door? Yeah, they're going to do that. Are they going to get too close? Yeah, that's going to happen. And I think what we have to remember is that the 6 feet is a guideline to remind us to just keep some distance, right? Again, Americans are, right? We love to embrace, that's who we are. We're gregarious, right? We're loud, we're gregarious. That's what separates us from a lot of the rest of the world, right? And so, especially with July 4th coming around, really important to just keep those principles. Yeah, 6 feet would be great. 5 works too. 1, probably not a good idea, right? Disinfectant, yeah, wiping down everything is really helpful. But don't go into the point of having paralysis by fear. The coronavirus, yeah, it lives on surfaces for some period of time. Yeah, but it really comes down to what is the amount of coronavirus that I am going to expose you to, or that you are going to get exposed to, right? So if I go like this and touch my mouth or my eyes, probably, if there were coronavirus on there, I probably wouldn't get it, right? But if you came into my hospital and you were short of breath and there was nobody else around and I had to intubate you, right, put a breathing tube on you, again, you being a hypothetical you, and you come in healthy and you're coughing as I'm doing that, and I don't have the appropriate PPE on, that's a high viral load, right? Because if you think about it, if you're sick enough from the coronavirus right? That means that when you're coughing, you're spreading a lot of coronavirus, right? So I think that just proper hygiene and disinfectant is great. I think it's going to work well. It is in the community, but it's not. It is spreading, and again, that's just what viruses do. But you know, we are all pretty healthy here, and as long as we abide by those simple principles, I think we got this. It's not going away. It's going to be here. So instead of being, again, paralyzed by fear, let's come up with a strategy. Let's have some basic principles that we abide by that become second nature.
I like what you're saying, not to live in fear, but to make sure that we're doing everything we can to protect ourselves and others. And hand washing, our kids are going to get so great at washing their hands this
Holly
year.
has a great song that she created. It's like over and under and in between. I don't know the rest.
Okay,
but
we'll have Holly train
yeah,
all
she
the
can
kids.
train everybody, or even better, you can have some type of contest
Yeah,
where
I
some
like that
kids,
idea.
you know, can do some Cold Spring song that lasts 2 minutes, and everyone reads it and sings it when they're washing their hands.
Okay, so we have our reentry plan,
Mm.
you know, of course, is to come in on the 18th, but things are changing, and that may very much well turn into a remote learning plan. We don't know. And the future is changing. So tell us, what do we, in your opinion, you know, what do you know about the future, and how should we prepare, and what does it look like?
Okay,
That's
let
a
me get out
loaded
my
question,
crystal
huh?
ball here, right?
Yeah.
So, I mean, all I can say is that if we treat coronavirus like we do influenza, then we would expect that the first vaccine would take about 16 to 18 months. And that vaccine, just like the flu vaccine, is not going to be 100% effective. So I do a lot of teaching in my job about the flu vaccine because there's a lot of people who are at risk of developing complications from the flu that don't get the vaccine. So I spend a lot of time explaining to them how vaccines work. And I'll save you the elevator pitch. But what I should tell you is that everything is changing, and viruses change too. And so whatever version of coronavirus we have now is likely going to be different fall 2020, which is likely going to be different than winter 2021. And so as long as we remain vigilant and flexible, we'll be okay. So we're really excited personally as to bring our kids back into Cold Springs. I think that there's an opportunity for us to have a face-to-face interaction. I mean, the thing about this that's really scary that no one's talking about, and again, I don't have the exact thing, is behavioral health. So I don't have the exact stats in front of me, but for every 1% increase in joblessness in the United States, it causes 20 to 30,000 behavioral health issues, like people with new mental health disorders, which then there's a percentage of that, right, that leads to suicide and death. So then you're like, well, this is like a double whammy here. It just goes back to the principles of, like, we just got to do the best we can with the information that we have. So, you know, what is the future? I don't know, but let's plan for the best. Let's hope for the best. Let's plan for the worst. Let's be flexible. Let's be communicative. If there's more questions that come up, I'm happy to answer them. If I don't know the answer, I'll bump it up to someone that does. Yeah, it's a really challenging time. And I appreciate what you guys are doing. I really do, because we love the school. We love the community. We wouldn't be able to do just the basics of parenting without it. I'm so thankful to be a part of the school, really, and I just want it to thrive in whatever way that is. So.
Well, we are so grateful to have your family.
Yeah.
Your family is just such a joy and a love, and
I think it's symbiotic, right? Like, I think everyone's just like ups their game when they, you know. I think
you're the best.
I think positivity and love wins.
Positivity and love.
Yeah, I mean.
Those will be our 2 words.
Yeah, well, I hope, right? I learned that from my kids, right? So.
Thank you, Dr. Kane, for being with us today. I know you didn't get home until 4 o'clock in the morning, and then you were here 3 hours later, and I appreciate you taking the time out of your busy day to really help educate the Cold Spring School community and to really help us as we plan and move forward as we re-enter school. So thank you again, and we appreciate you and your entire family. Cold Spring School community, again, I'm really looking forward to having all of our kids back on campus in the fall. We're hopeful we can continue to move forward. We'll be continuing to watch what happens locally. But as of now, plan A is that we move in and we move forward by having your child on campus. And again, I'm looking forward to being together, and we've got this. I like what Dr. Kane said, positivity and love. Those are going to be our 2 words as we move forward next year. Thank you.